Well, come on in.
Dr. Michael Ciampi was fed up.
Just have a seat.
The family doctor from Portland, Maine used to do lots of paperwork, so much it was taking time from his patients. So earlier this year, he stopped taking Medicare and other insurance altogether.
We ask patients to pay at the time of service, just like you would be expected to pay at time of service at your garage, at the barber shop, or at the grocery store.
Under his new system, Dr. Ciampi's prices are clearly marked on his website. $75 for an office visit, $150 for a complete physical.
$75.
That's roughly in line with how much he'd been receiving from Medicare and private insurance plans. With less paperwork, his operating costs are much lower as well.
We've had real cost savings already in that we've been able to cut our staff down. We have one full-time employee to support me, and she answers phones and draws blood and so forth. And so that's been a huge savings.
He says he now has more time to focus on his patients and even make house calls.
So how you doing, Rudy?
But for many patients, they can't pay out of pocket. Dr. Ciampi says he's lost a quarter of his roughly 2,000 patients, but he expects others to take their place.
Hey, God bless.
He admits his model works best for those who either lack insurance or who have high deductibles. An hour north of Portland, another family practitioner, Dr. Michael Clark, understands Ciampi's frustration.
The idea of a streamlined, simplified billing and collection practice is very attractive. A lot of us hunger for a simpler structure to our practices where it could just be about the care we give to our patients.
But in this rural community, Dr. Clark felt he simply couldn't turn away as many senior patients who are reliant on Medicare. And some experts say other groups would also be vulnerable.
There are not that many patients who would be able to put up with this. Some very rich patients, of course, they could do this, but a lot of low-income people couldn't afford the fees.
But with endless bureaucracy and costs that often seem out of control, some doctors are trying different tactics to stay in business. Christine Romans, CNN, New York.